Assalamu alaikum and welcome back to another episode of What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board certified physician. My show, What's Up, Doc, is a production of Muslim Network TV, the only Muslim focused network broadcasting in North America. You can watch all of our shows streaming on Roku TV, Apple TV, Galaxy 19, and Fire TV. You can also find us on our website at muslimnetwork.tv and on our YouTube page at youtube.com/Muslim Network TV. Summer is finally here, and along with that is spending time outdoors and out in the sun. Today, we're going to be talking about a condition that affects 1 in 5 people and can affect people who are spending a lot of times out in the sun, and that is skin cancer. Joining us to talk about that and sun safety is Dr. Ammar Ahmed. Dr. Ahmed is an associate professor in the Division of Dermatology at Dell Medical School at the University of Texas in Austin. He practices general dermatology and performs research in the arena of pigmentary disorders. Dr. Ahmed also serves as Dermatology Residency Program Director. Welcome to our show, Dr. Ahmed. How are you?
Assalamu alaikum. Thank you. Great. Thanks for having me on.
Wa alaikum assalam. It's such a pleasure and a treat to have you today. As I mentioned in the introduction, summer is upon us, and I'm enjoying some sunshine here in Texas. As you know, we've had a lot of rainy days as well, and so it still feels like spring, but I know the hot, sunny days are coming. And so with that, it's important for us to talk about sun safety and some of the things that we need to be aware of and take precaution from to protect ourselves from some of the bad things that can come along with the sun.
Indeed.
So to start off the conversation, let's talk a little bit about skin cancer and the different types that exist. Let's go through what you treat or what you typically see as far as the different kinds of skin cancer, and describe to us a little bit about how they occur, how they come about.
Sure. So skin cancer is common. It's actually by far, not even close, by far the most common cancer in the United States. There's 3 major types of skin cancer. There's a few kind of weird uncommon types, but the 3 major types are basal cell cancer or basal cell carcinoma, squamous cell carcinoma, and then melanoma. And so if you were to rank these in terms of how dangerous they are, basal cell carcinoma is the least aggressive and the least dangerous. Squamous cell carcinoma is in the middle, and melanoma is the bad guy. That one, it can be quite aggressive. In terms of prevalence, it's the opposite. Basal cell carcinoma, fortunately, is the most common of those 3. Squamous cell carcinoma in the middle, and melanoma is the least common, but it's still pretty common in the grand scheme of things. Now, how do they come? There's different causes for skin cancer. In general, light-skinned people are at higher risk for skin cancer than those of us with more melanin in our skin or darker skin tones. But sun is not the only risk factor. And let me give you an example. One of the other major risk factors for skin cancer is immunosuppression, which means your immune system is lowered for some reason. And we know, for example, there's let's say people who've had an organ transplant. And when you've had a transplanted kidney or heart or liver or whatever it may be, you get a lot of medicines that lower your immune system so you don't reject the organ that you got. And people with who've had a transplant are something like 30 times more likely to develop skin cancer than someone who hasn't. So there's a lot to skin cancer that we don't really know. It has to do with sun exposure, it has to do with our immune system, it has to do with genetics, and there's probably this black box of other risk factors that we don't exactly know.
Wow, 30 times. That's really high, Dr. Ahmed. And so is the idea behind that with immunotherapy or reduced weakened immune system that the immune system is a part of helping to protect our skin against these cancers?
Exactly. Yeah. And so not just the skin, when we think of our immune systems, normally when we think about that, we just think in terms of infection, right? Immune systems fight infection. That's what they do. But what a lot of people don't realize is that immune systems also fight cancer and they prevent cancer. And so when you have a situation in which your immune system is altered for whatever reason, whether it's due to medications you're receiving, whether it's due to some other underlying condition, whether it's due to HIV or something like that, all of those conditions can decrease your body's ability to fight off cancer when it's developing. And what that results in is actual cancer, and including skin cancer. And that's why people have a higher risk of skin cancer if they're immunosuppressed.
Certainly. Now, you mentioned risk factors, and you said that there are quite a few, some that we do know and some that we don't know. One that I think that we have been hearing a lot of, and we probably do know, is our exposure to the sun, right? And so that's a cumulative from what I understand. And I understand that a lot of that happens in our childhood. And the second part is tanning beds, which I don't know how popular they are now, but in the 90s, I know that they were very popular. And so let's talk a little bit about that, please, and how that exposure can affect the risk, if you have numbers to kind of show or to share with us as well.
Sure. So indoor tanning beds are a no-no. That they are a carcinogen. So the World Health Organization has listed a few things in the world as a carcinogen, and one of the things that listed as carcinogen is indoor tanning.
And so just to be clear, I just want to be clear, Dr. Ahmed, for our audience, when you say known carcinogen, we're talking at the level of, we know that cigarettes cause lung cancer, correct?
Oh, yeah, exactly.
Yeah,
so,
that's the level. I just want to be clear to everyone. That's the level we're talking about here.
Exactly. So indoor tanning booths are a known cause of skin cancer, including melanoma, which is the most aggressive type of skin cancer. Now, how much that increased risk is, I don't know off the top of my head, but it's a substantial increased risk. And it's also cumulative. If you go one time to a tanning booth, okay, not good. But if you go multiple times over long periods of time, you're increasing your risk. Now, here's where it gets interesting, right? So if you look at skin cancer as a whole, in a lot of people of color, right, people who have more melanin in their skin, it's not entirely clear how much sun exposure is actually a risk factor for melanoma and maybe for other skin cancers as well. It's actually a controversial topic. There's people that argue both sides of that equation. But regardless, indoor tanning and tanning booths, I would certainly recommend against that for anyone, no matter your skin type. For just regular sunlight, regular ultraviolet light, when you're outside, you want to be careful. You want to try not to burn. You mentioned cumulative sun exposure. So it gets a little bit more tricky. In general, yes, cumulative sun exposure tends to be a risk factor for skin cancer. But for certain types of skin cancer, it tends to be more the cumulative amount you've had over your life. And then the others, for other types of skin cancer, it's more, have you had really intense periods of sun exposure in which you got a sunburn, for example, right? So maybe you actually haven't had a ton of sun exposure over the years, but you had some really bad, really nasty sunburns when you were younger or whatnot. That could still potentially put you at risk, or vice versa too. Let's say you never really had really bad skin cancers, but you worked outside your whole life and you didn't protect from the sun. You just had a lot of cumulative sun exposure. That could also be a risk for different types of skin cancers. So yep, you want to protect from the sun, but again, for people of color, we don't know exactly how much of a risk the sun is for skin cancer, including melanoma.
Interesting, very interesting. And so I want to also underline that last part. You said that a lot of people of color assume or presume because we have melanin that we're protected and will not do some of the things we'll talk about later as far as sun protection, but the risk is still there, as you said, and so it's important to be aware of it, essentially.
Yeah, it's important to be aware of it, but I think it's also important to understand the nuances, right? So, for example, one of the more common locations for skin cancer in Black individuals, a lot of our African American individuals, is on the palms and on the sole. Right, and around like the nails, for example. Yes. Not a terribly common location in general for skin cancer, but that's one of the more common types. And we think that is probably not necessarily due as much to sun exposure. There's probably other reasons that we don't entirely know, whether that is, again, some other genetic predisposition, whether it's something else going on. So I think it's important to be thinking about sun and ensure people don't get sunburns or whatnot, but we want to make sure we don't simplify that you just don't protect you just protect from the sun and you're okay, right? I mean, skin cancer can be tricky. It can come lots of different ways, including on the bottom of your foot, where you would never get a sunburn, but if you have like some weird mole on the bottom of your foot, well, you got to get it checked out. That could certainly be skin cancer.
Absolutely. I love that. Thank you for clarifying. So it's not just sun exposed areas. We should all be looking for this regardless. And we'll get to that later as well, as far as what we can do for prevention and how to, if you spot something, what we should be looking at. Before we do that, I do want to talk about the different skin types that you mentioned. You mentioned some of the risk factors were skin types. So if we could just break that down, because I think it'll help our audience to also understand why some people with certain skin types are more prone to tanning, meaning when they go in the sun, they may get a nice tan, as opposed to some other people who go out into the sun and they get a sunburn. So if we can also go over those skin types, because I think it's important to also highlight the skin types that may be at higher risk for burning and getting injured in the sun.
Yeah, for sure. So, we have this technical classification. It's called the Fitzpatrick skin type, and we break people down as Fitzpatrick 1 through Fitzpatrick 6.
You got to put them in a box.
Yeah, at the end of the day, it doesn't really matter that much, right? The key is that in general, the lighter skin you are, the fairer skin that you have, the less protection you have against skin cancer. At the end of the day, that's really kind of the crux of it. And partly is because you burn. I mean, in general, people with fair skin tend to burn more easily than people with more melanin in their skin, people who have a darker baseline skin color. And someone who has darker baseline skin color, as you mentioned, Aalia, oftentimes you end up tanning, right? So, if you get a lot of sun out there, if you're sitting at the beach, if you have very little baseline melanin, you're going to burn very easily. If you have more baseline melanin, i.e. you're darker, then oftentimes you will tan, but only to an extent. I mean, I've gotten sunburns, people darker than me can get sunburns. I mean, so at the end of the day, you can still burn, but that tanning is a protective mechanism that tends to happen in people with darker skin tones. And so that's probably part of the reason that they have lower rates of skin cancer, and that sun may not be as much of a factor, because it may not be actually causing that damage to the skin, that burning, that damage to the skin that results in mutations in the skin and all of that results in skin cancer.
Excellent. Thank you for breaking that down very, very clearly. So I have also gotten sunburned, which the first time I did, I was very surprised. I remember I was a teenager and I was like, why am I peeling? But I also was the type of teenager who would slather myself in baby oil and sit in the sun for hours, which I now, as an adult, I have no idea why I did that. But I mean, you live and you learn, right?
Yes.
So the next thing I want to talk about is what are some of the things that kind of signify or help someone identify a possible skin cancer? What are some of the symptoms that the general public should be aware of? Or if they see a rash or a lesion on their skin, what are some things that might make them nervous, or, I don't want to say nervous, but make them, alert them is the best thing, I would say, to bring this up with their doctor and to seek guidance on what they should do with that skin lesion?
Sure. So, the different types of skin cancer can look different, right? Again, basal cell, squamous cell, and melanoma. Most time melanoma, which is the most scary one, looks black or looks dark, purple, brown. Not always. Sometimes it can be tricky. Sometimes it can look reddish. It can be funny, but most of the time it looks like a mole that's weird, right? So we talk about the ugly duckling mole, right? If you have moles on your skin and one of them just looks different it's changing, it's growing, it's looking irregular, it's looking asymmetric, right? So if you cut it either this way or you cut it that way and you flip it on itself, it just doesn't match up. That's a sign, hey, I should potentially get this checked out. If something is larger than other molds, and especially 6 millimeters tends to be a number that a lot of melanomas kind of comply with. They tend to be a little bit larger than that. It doesn't mean you can't have a melanoma smaller than that, but if something is kind of bigger, 6 millimeters is usually about the size of a pencil eraser. So if it's bigger than that, and especially if it looks different than the others, especially if it's got multiple colors or shades of colors, especially if it's got an irregular border, especially if it's changing, those are the ones we should say, let me go get this checked out, which is totally different than basal cell cancer and squamous cell cancer. Those usually, not always, but usually are not dark colored, right? They're usually a pink bump or a red bump. That's just weird. It looks, again, different than the rest of any pink bumps or red bumps you may have on your body. That oftentimes, but not always, tend to be in sun-exposed areas like the face, the chest, the arms, the upper back, but not always. Or the other thing that they can present with basal cell and squamous cell carcinomas is things that don't heal. So I have a bump that's started bleeding, and then it kind of heals up, and then it somehow starts bleeding again, or it's like it just got the scab on it that doesn't heal. That's kind of a telltale sign that, hey, I probably ought to get this checked out. And then one other thing. So we talked about color, right? So the melanomas are usually brown or dark, right? Basal cell and squamous cells are usually not. But here's where it gets funny again, right? So there's something called a pigmented basal cell carcinoma.
Oh my goodness, just to throw you for a loop.
They look brown. And again, where I tend to see that more is, again, in our patients of color, right? A lot of our Hispanic patients, for example, that can be a manifestation of basal cell carcinoma in some of our patients of color as well. So it can be tricky, and basically your baseline skin tone can affect a lot of things, including your predisposition to skin cancer, and oftentimes even where they present and how they look as well.
Wow, that was I really enjoyed that because you broke it down beautifully as far as the melanoma cancer and non-melanoma cancers and what they can look like. As a rule of thumb, and I'm sure you probably tell your patients this as well, to simplify it even further, I teach them a mnemonic ABCDE, asymmetry, border, color, diameter, elevation, evolution. So that touches on the things that you just mentioned, with evolution being a changing lesion, meaning that it used to be a certain way and now it's different in some way. Either it's raised or it's painful or it's bigger, etc. So I use that mnemonic to help my patients to kind of break it down easily. And that way, I'd rather they be overly cautious than forget, be like, it's nothing, and it turned out to be something.
Definitely, yeah. We use that all the time too. And of that, the A, the C, and the E, I think are the most important, right? So if you had to pick three of those, asymmetry, color, just looks a little different, multiple colors, something like that, and then evolving or changing. I think those are the three key. But the whole mnemonic is a useful one. We use that all the time.
I agree. And so it's time for a break now, Dr. Ahmed. I'm really excited to continue this discussion, but we are going to take a quick break here. You're watching What's Up Doc on Muslim Network TV, and we'll be back after the short break.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3.
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
If I could be you, and you could be me for just 1 hour. If we could find a way to get inside each other's minds. If you could see you through my eyes instead of your ego, I believe you'd be surprised to see that you've been blind. Walk a mile in my shoes. Walk a mile in my shoes. Yeah, before you abuse, criticize and accuse. Walk a mile in my shoes. Walk a mile in my shoes. Well, before you abuse, criticize and accuse. Walk a mile in my shoes.
Find out how to use an awkward silence to help a friend with their mental health at seizetheawkward.org.
Assalamu alaikum and welcome back to What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and today we are joined by Dr. Ammar Ahmed, and we are talking about skin cancer and sun safety this summer. All right, so Dr. Ahmed, before the break we've been talking about some of the risk factors for skin cancer. We've talked about some of the things that you need to pay attention to if you have a lesion that might be concerning, and to bringing it up with your medical provider. Now, walk us through a patient who comes into your office and he or she says, "Doc, I've got this thing on my neck, my hand, and I'm not quite sure if this is skin cancer, but I'm kind of concerned. I've noticed X." What are the steps that you take as a dermatologist in diagnosing or working through that lesion to confirm, or to make sure that it's not skin cancer?
Yeah. So first thing is we look at it, and sometimes I tell people, I don't know.
I hope not. No patient wants to hear a doctor say that.
Well, but that's because sometimes you just don't know. Look at that. Sometimes you do. Sometimes you don't. But when you don't, we have it out, right? We dermatologists have a little tool called the biopsy, right? And so, for things that are tricky and we don't know, sometimes we just need to biopsy them. And a biopsy is not as scary as a biopsy of any other organ, right? If you're getting your kidney biopsied or your brain biopsied, it's intense, right? A skin biopsy is an invasive procedure, but it's a minimally invasive procedure. We just numb it up and take a little piece out. And so that's a very common thing that we have to do. We biopsy things all the time in clinic when things look suggestive of skin cancer. So again, oftentimes we can look at things and say, that's a mole, that's nothing bad. And we just keep an eye on it. Sometimes if it's kind of in the middle, we're like, it's got some irregular features, but we still favor that it's a benign growth. Sometimes what we'll do is what we call photographic monitoring. And so we'll take a photograph of it. It goes into the medical record. Oftentimes we'll actually have our patients snap a photograph with their phone as well. And we'll tell people, hey, you put a little reminder in your iPhone calendar, 3 months, check your mole, 6 months, check your mole, 9 months, check your mole, and they keep an eye on it. And if it changes, it grows or anything, they come back in, we take another look at it. If it's indeed changing, oftentimes we need to biopsy it. But for things where they just look weird, we just look at them, we're like, you know what, that just looks a little too suspicious, or we just can't tell. We're like, this certainly could be skin cancer. We need to figure it out. That's when we generally biopsy things. And a biopsy can be done on the fly. Usually it's a 5-minute little procedure, and we send it to our expert pathologist, and they look at it and they give us an answer. And the good thing is the vast majority of skin cancers can be treated and cured relatively easily in an outpatient surgical type procedure. Usually not require any hospital care, any chemotherapy or radiation. There are, again, certain ones, very advanced skin cancer, some of our advanced melanomas, things like that do. But the vast majority of skin cancers, assuming we catch them at a relatively early phase, can be treated and usually cured in the office. And it's not, at the end of the day, it's usually not too big a deal in terms of having, significant long-term effects on the patient.
I love it. So thank you for being real, first of all, right?
Yeah.
Sometimes we don't know, but we have tools that can help us to figure things out. And so a biopsy is a really important tool that we have, or that you have as dermatologists and some practitioners as well. Now, let's say somebody's got something and you think it may be suspicious, and you do a biopsy and it is cancer, right? Why is it important to treat that? Let's say you just said that most of the time it's no big deal, it's curable. What if they just say, you know what, you said it was basal cell, it's not going to kill me, let's just leave it alone, let's just not treat it? Why is it important to actually treat skin cancers? Let's go through that a little bit. It may be obvious to some, but for people who maybe their health is not a priority for whatever reason, there are lots of patients or people that I know who, unfortunately, their circumstances doesn't allow for their health to be a priority. Why is it really important to make sure that we're encouraging them to get that treated?
Yeah, good question. So melanoma, let's start with melanoma. Melanoma has a high risk of metastasis if it's not treated. Metastasis
spread. Break that down, yeah.
Body goes to your lymph nodes, goes to your blood, can go to your other organs, and can kill you, right? So that one, you need to cut that thing out, right? So if you diagnose a melanoma, it needs to be cut out and taken care of. Now, if they're more advanced melanomas, sometimes other treatments are needed, chemotherapy or other types of treatments. But usually, again, early melanomas, you just got to cut them out. Let's talk about the basal and squamous cell cancers, because Aalia, it's an insightful topic and question. These things most of the time don't metastasize, don't spread through the body, and most of the time don't kill people. So why are we even treating this? What's the purpose behind it? At the end of the day, the key is not just to prevent things from killing people, but to prevent things from adversely affecting the quality of people's lives. And so basal cell cancers, for example, which is even the least aggressive variety of skin cancer, if untreated, they will grow. They will grow both horizontally and they will grow vertically, which means they will go deeper into your skin. And we see all the time advanced cases of basal cell cancers that have been neglected for a while, and they have invaded into the deepest layers in the skin. They have invaded into the muscle below the skin. They have invaded into the bone below the muscle. And suddenly something that could have been a little 10-minute surgical procedure, take it out, no big deal, has suddenly turned into this gigantic tumor on this patient's body that is bleeding, that is painful, that is affecting the quality of the person's life. And oftentimes if it's on their face, it can affect your nose, it can affect your eye, it can affect your vision, it can mess up your ear, it can affect a lot of different things. And now you have a large tumor in which you have to surgically take out. You may have to do radiation or sometimes chemotherapy for something that is, in an early stage is minimally aggressive. It can be treated easily. So that's why we recommend early treatment of skin cancer no matter what. Now, one other thing. So let's talk about that guy in the middle, squamous cell cancer, right? More aggressive than basal cell cancer and less aggressive than melanoma. But squamous cell cancer, even though it has a relatively low metastasis rate, again, that means most of the time is not going to spread. The issue is that they're so common that if you look overall, there's actually a decent number of people out there that have squamous cell carcinoma that can actually spread and kill you, right? Even if it's just 1 out of 50 or so. Well, if there's so many people, you're going to have people for whom squamous cell carcinoma can spread and it can kill you. And again, back to when we talked about near the beginning, people who are immunosuppressed, right? Let's say you have chronic lymphocytic leukemia, which is a type of leukemia that, that's relatively common. Those people have much more aggressive or a much worse prognosis with squamous cell carcinoma. Or again, as someone who's had an organ transplant, on average, you will have a more aggressive squamous cell carcinoma and a worse prognosis. And believe it or not, squamous cell carcinoma of the skin, usually not something that kills people, is one of the highest causes of death in someone who's had an organ transplant.
Wow.
Right. So at the end of the day, we have to treat these things, again, to summarize, A, because they don't spread where they are locally on your skin and cause problems. And B, remember that even though the odds are low, they can spread, especially squamous cell carcinoma and definitely melanoma, and they can do bad things and even kill people some of the time.
Gosh, so like you said, really something that could have been a quick in-office procedure is now becoming a much bigger problem and more difficult to treat. So thank you for sharing that. Now, the other type of patient that I get sometimes, I mentioned the one that comes in with a lesion, but there are patients who come in that may be just higher risk for skin cancers due to, as some of the things we mentioned, either their skin type, their fairer skin, family history, maybe the medications that they're on, et cetera, or they're immunosuppressed. And so for those patients, I usually recommend a skin check for them.
Yeah.
And for a lot of people, that may be a new concept to them. They've never heard of that because it's not part of their screening that they may be getting from their doctor's office. And so I think it's really important. I'm a big prevention is better than cure person. And so I want us to talk a little bit about and I usually refer them to a dermatologist for this skin check. So tell us what you do when a patient comes in for a skin check visit. What does that entail and what do you do during that visit?
Yeah. Well, let's first talk about, if you don't mind, who should get skin checks.
And thank you. I was thinking that. I'm like, I wanted to say, and who should get it? But
who should get skin check, right? Let's say if you're just walking around, should you get a skin check?
Yeah, exactly.
I think it's probably not necessary and cost effective if you don't have risk factors, right, for skin cancer, right? So if you're not someone who's very fair skinned, if you're not someone who has a strong family history of skin cancer, if you're not someone who has a ton of moles on your body, if you're not someone who has atypical moles or moles that look weird, irregular, atypical, if you're not someone who's already had a precancerous spot or a cancerous spot on your skin, if you're not immunosuppressed, if you never had a organ transplant or anything like that, in that scenario, you could make a strong argument not to, that you just want to be vigilant. Now, I think everybody should be vigilant. Keep an eye on your skin. Again, if things are changing, growing, bleeding, not healing, looking funny, get them checked out. And ideally, it's hard for us to keep an eye on our backs and, the back of our legs and all those areas. So someone can help you periodically keep an eye on things, that's certainly better. So I think it's reasonable to do an as needed approach in those scenarios if none of those risk factors are there. If somebody has risk factors, if you've personally had skin cancer before, or if you've got 2 family members who've had melanoma, or if you just have a ton of atypical moles on your body, or you're very fair skin, red hair, blue eyes, you've had a lot of sunburns before, if you have like these little rough precancerous spots on your face or your arms called actinic keratoses, they're little rough kind of pink areas. Those are signs that, you need to be friends with a dermatologist. You need to establish with somebody, get in regularly and get checked. What do we do during the skin check? Well, we usually get people into a gown and, we go head to toe and we look everywhere. We focus both on areas of sun exposure, face, arms, areas like that. But remember, these things can be tricky. Skin cancers are not always in places of skin exposure. If you look at the most common location for melanoma on the legs, most common location for melanoma in a lady, in a female, it's actually the back of the legs. All right, that's the most common location. And so at the end of the day, that's a place that probably gets some sun exposure and maybe periodic sunburns, but it's not getting as much sun as your face most likely, or your hands most likely. Yeah. That's the most common area. So at the end of the day, we do a full skin examination for people who have things that look funny. We have little tools and little devices that help us take a better look at them. And again, sometimes we do photographic monitoring, and sometimes if things look really weird, we may need to do a biopsy. Also, if people have little precancerous areas, sometimes we need to use this like cold liquid nitrogen spray to zap those little spots to get rid of them so they don't turn into skin cancer.
Excellent. Thank you, Dr. Ahmed. Very thorough look from head to toe, essentially. And I know for some dermatologists that includes looking in the groin as well. Like you said, it's not all sun exposed areas. Now, you mentioned earlier the treatment, and so you said it doesn't typically involve chemo. Let's briefly talk about, before we jump into our next break, what should someone anticipate if they are diagnosed? And I know it's going to vary from one cancer to the other, but I guess maybe some broad strokes as far as some of the treatments that are available for skin cancer.
Yeah. So it all depends on what type of skin cancer and how aggressive it is, right? And so even if we know something is skin cancer, when I look at it, sometimes I do know that something is skin cancer, believe it or not. And so, we take it off, we do a biopsy, because the purpose of the biopsy is not just to tell us, okay, it's skin cancer, is to tell us what type. And again, it gets more complicated than just basal cell squamous cell melanoma. There are subtypes of basal cell carcinomas. There are subtypes of squamous cell carcinomas. There are features of melanomas that are more aggressive or less aggressive. So we need the full picture which the pathologist gives us. When they give us the pathology report, then we can say, okay, this is the type of skin cancer, this is how advanced it is, this is how aggressive it is, and then we kind of come up with the right procedure. In general, the cornerstone of treatment is some type of surgical treatment. That can be an actual surgery where we cut it out and we throw stitches in there. It can be something where we just take this sharp tool and we scrape out any residual tumor after numbing it up, of course.
Yeah, thank you for adding that. I don't think anyone will come in for treatment if you hadn't said that.
Exactly. We know about that. We give you a bullet to bite.
Back in the old days.
So there's those different types. So the vast majority are treated via some type of destructive or surgical modality, generally in an outpatient office. Okay. Only in the more advanced non-melanoma skin cancers and the more advanced melanomas do we need to do other things. And that other things may be imaging, a CT scan or something to see if it's gone to the lymph nodes. It may be some type of chemotherapy or radiation. But again, that's in a relatively small subset of tumors, both melanomas and especially non-melanomas.
Thank you. Thank you for that, Dr. Ahmed. So again, just reiterating something that we said earlier, go early, go when things are a smaller problem rather than a big problem so that the fix is also smaller. And with that, we're going to jump into our next break here. And when we come back, we're going to talk about some ways that you can protect your skin and some things that you can do to help be safe in the sun. You're watching What's Up, Doc, and we'll be back after this short break.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3.
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
Find out how to use an awkward silence to help a friend with their mental health at seizetheawkward.org.
Assalamu alaikum and welcome back to What's Up, Doc. Today we're joined by Dr. Ammar Ahmed and we have been talking about skin cancer and sun safety. So before the break, Dr. Ahmed, we were talking about just the ways to diagnose and to treat skin cancer. Now, finally, I think we're at a point where we can talk to our audience about sun safety and how to protect ourselves. We spoke at the beginning how not all skin cancers are due to sun exposure, but the ones that are, at least we can offer some kind of protection for ourselves to help reduce that risk. And something that I struggle with my patients is when I counsel them, I counsel them for sun safety and protection, but then I also then they ask me, well, doc, my vitamin D is low and I know that sitting out in the sun is really helpful for my vitamin D. And so I want to pose that question to you. How do you answer that for your patients? I know that we tend to know that vitamin D production, some of it happens, or the activation, not to get into the details of that, happens in the skin. And so there's benefit from the sun. But as we just spent the last few minutes on this episode talking about, there's also dangers that come along with sun exposure. So how do you balance that? How do you answer that question for our guests who may be thinking that same thing?
Yeah. It comes up a lot.
Imagine.
So here's the thing. So in my opinion, it has to do with your baseline risk.
Okay.
And your baseline risk is largely, but not completely, due to your baseline skin tone, right, your skin color. For a lot of our lighter skin patients, especially those that are at higher risk for skin cancer, it's probably not worth it because there's other ways to get vitamin D, right? At the end of the day, it probably makes more sense to protect well from the sun. Wide-brimmed hats, sun protective clothing, sunscreen regularly, SPF 30 or higher. And if you need vitamin D, take a vitamin D supplement. The other thing is if you have lighter skin, you're honestly going to be more efficient at making vitamin D from, the little sun that you do get. So that's probably kind of the best approach and generally what we recommend for someone at high risk for skin cancer, especially a light-skinned individual. Now, for some of our darker skinned individuals, it's not necessarily the same advice. We do individualize our advice. We never want people to burn, out in the sun. But at the end of the day, a lot of our darker skinned individuals are going to be at higher risk for vitamin D deficiency. And if you look at the risk balance between getting natural sunlight, and increasing your risk for skin cancer, you could make an argument for some, of the darker folks out there that it's probably not a terrible idea to get some sun, as long as it's relatively, cautious, you're not burning or anything like that. It's probably, not unreasonable. At the end of the day, when we think about our public health messaging, right? I'm a dermatologist. It's almost like, it feels against my religion to say, you don't need to wear sunscreen, right? I'm a dermatologist. That's what we tell people to do, right? Wear sunscreen, protect from the sun, right? But at the end of the day, there's also a danger in oversimplifying things, right? And saying it's a one size fits all strategy and advice for everybody out there, right? So for some of our darker skin patients, you may not need to wear sunscreen, all the time when you're outside, because at the end of the day, sun may not be as strong of a risk factor for you in developing skin cancer. Now, here's where it gets tricky, though, right? So when we talk about sun protection and sunscreen, it's not just for skin cancer, right? That's the issue, right? So far in this last 40 minutes or so, we've talked about sun protection for prevention of skin cancer. Mm-hmm. There can be other reasons to protect from the sun, right? One of which is photoaging. If you get a ton of sun just over the years, well, you're probably going to develop wrinkles and blemishes and dark spots earlier in life, right? So that could be another reason to protect them from the sun, apart from risk of skin cancer. And that can be irrespective of what your baseline skin tone is. And then number two is dark spots, right? So I actually have a special interest in disorders of pigmentation, when people have dark spots on their skin or light spots on their skin. And again, this actually affects people of color more than a lot of our Caucasian and light-skinned patients, right? If we have dark spots on our skin, whether that's melasma, whether that's spots left over from acne, whatever that be, that sure as heck is a good reason to protect from the sun, sunscreen and hats and that type of stuff. Because if you get a lot of sun, those spots are just going to stay darker for longer. It's very, very, very difficult to treat those spots and make those spots lighter if you're getting a lot of sun, right? So to kind of summarize, when we think about sun protection for someone, we think first, okay, is this just for skin cancer prevention, or is it for something else, right? Photoaging protection, prevention of dark spots or whatnot. If it's all of the above or more of the latter, well, then honestly, no matter what your skin tone, you need to protect from the sun. SPF 30 or higher, hats, all of that type of stuff. But if it's really just skin cancer someone's worried about, then it's probably reasonable to make individualized recommendations on sun protection and sunscreen based on your underlying skin tone and your risk factors for skin cancer. And knowing that, we do sometimes balance that with people's desire to get some natural vitamin D and whatnot, if that makes sense.
It does. It really does. And that was a very thorough answer. I really appreciate that you brought up, like you said, we have spent this episode and is geared towards talking about some skin cancer, But there are other benefits to protecting ourselves from the sun, as you mentioned, photoaging and dark pigmented spots from getting darker or lighter, etc. And as someone who is very much into sun protection, I wear driving gloves, I wear SPF, and I'm always wearing wide brimmed hats if I'm out in the sun for too long. So as somebody who's pigmented or a person of color, I think I stand as an example of someone who's trying to help delay the photoaging effects as well, even if my risk for skin cancer may be low from my sun exposure. Yeah. So I appreciate that. Now, there is a little bit of a debate, especially when women are trying to choose, because honestly, it's more women than men who are wearing sunscreen, as far as what is the better choice for sunscreen. You mentioned SPF of 30 and higher, but there are also other things that distinguish different kinds of sunscreens, mineral versus chemical sunscreen. Do you have a preference? Do you recommend one over the other? Is one better? What are you telling your patients if they ask you?
Yeah. So first, a couple of things that your sunscreen needs to be. SPF 30 or higher. The higher the better, but at least SPF 30. It needs to be broad spectrum, which means it encompasses both UVA and UVB protection, which are the two major types of ultraviolet light that come from the sun. Now, these days, the vast majority of sunscreens are broad spectrum, right? If you go to Target or CVS and you look at them, most of them will say broad spectrum, and you can rest relatively assured that that is accurate, and most of them actually have pretty good UVA and UVB coverage. Mineral sunscreens, right? So mineral sunscreens are generally ones formulated with zinc oxide and or titanium dioxide in the United States. Those ones tend to be my favorite, and it's largely because of their potential safety or the theoretical risks with other ones as opposed to effectiveness. You could probably find comparably effective sunscreens that are the non-mineral sunscreens. Okay. But there were some articles that looked, for example, there's one article like a year ago or so that got some interest in the lay press. And that was about your blood levels of sunscreen after applying sunscreen. And it showed that some of these sunscreen agents, you have measurable levels of the sunscreen in your blood. Now, nobody knows what that means. Is that dangerous? I don't know, right? I mean, it's interesting, and it's something that probably deserves further study. Now, that tends to not be the case with the mineral sunscreen. So the zinc oxide and or titanium dioxide formulated sunscreens should not do that. So those tend to be the ones that I recommend the most if someone is just asking for a recommendation. But there's a catch with everything, right? So the catch with the mineral sunscreens is that sometimes they don't blend in as easy to the skin. They can leave a bit of a whitish hue. There are some brands that do more of that than others. So there are ones that are a little bit more cosmetically elegant, in my opinion. There are also ones that have tint with them. You can have like a tinted sunscreen, and those don't leave as much of a whitish look. It can, leave a little bit of a different look, but not necessarily a whitish look. But I like the mineral sunscreens. They tend to be good, simply because we don't really know all of the risks with sunscreens, and there could be, something in terms of the other non-mineral sunscreens, getting into your bloodstream that we don't really know the safety of.
Thank you for sharing that. Thank you for touching on tinted versus untinted, because that's another question I always wonder. Is there a benefit from one? But I guess if there is a bit of a whitish cast, as you mentioned, especially on darker colored skin, maybe the tinted may be the way to go if it blends in better for you.
And not just that. So that's one reason. But like, for example, let's get back to pigmentation, right? So something called melasma, more common in women than men, dark patches, oftentimes on cheeks, sometimes forehead. If you look at melasma, even visible light, so there's a light like right above my head in this room. It's just an indoor light, right? We call that visible light. It's not ultraviolet light. That can trigger melasma to some extent as well. Not as much as sunlight, but that can trigger melasma to some extent. And even if you have a broad spectrum sunscreen out there, it is not going to block visible light. Broad spectrum just means it blocks all ultraviolet UVA and UVB light. It doesn't mean it's going to block visible light. The one thing that can help block visible light is tint. The tint in sunscreens usually comes from iron oxides. And the iron oxides that are in there that can help block, this type of visible light. And that can be helpful, again, not for skin cancer, but for other things like pigmentation and whatnot. So, I'll throw in a vote for kind of tinted sunscreens for a lot of our patients. I mean, not necessarily everybody, though.
Yeah. And with the disclaimer that you are not supporting or endorsing any particular brand and you're not being paid, right? I'm assuming to say anything good about one company versus another. Can you share a couple of examples for those in our audience, especially those in the United States who may have access to some of the brands that you feel comfortable recommending?
Yeah, there's some good ones. At our office, we sell the Elta line of sunscreens, and I feel like that's a good one. They tend to be, probably a little bit more cosmetically elegant than some of the other mineral zinc oxide based ones. There's also, even simple ones. Neutrogena, for example, they make one called Sheer Zinc. I think I got the name correctly, and that tends to be just a plain kind of mineral sunscreen. So there's a lot of good ones out there. Again, some of them tend to be blend into your skin a little bit better than others, but there's plenty of good ones out there.
Thank you, Dr. Ahmed. And I just realized that we are out of time. We've just been chatting away. I've really enjoyed my conversation with you today. I think we covered a really important topic that's really important year long. We didn't really get into talking about sun protection, even on days that the sun is not visibly out, because we're still exposed to those UV and broad spectrum UV rays that you mentioned earlier, even on cloudy days. But with that being said, I really appreciate you taking the time to come on here today and share with us your knowledge and your expertise. And we wish you every success in your career.
Well, yeah, thank you for having me. It's my pleasure.
Of course. Thank you for joining us on another episode of What's Up, Doc. You can watch all of our episodes on our YouTube page and on our website at muslimnetwork.tv. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc.